Thanks, Conrad, Igor. Thanks for the opportunity of being on the podium today. We'll see how much blood is spilled or if we even break the skin. But I've been assigned a topic. The train stops here. I guess I would like to, there we go. This is going the wrong way. I guess I would like to maybe rebrand my talk as let's just pump the brakes for a minute. Robotic surgery has increased rapidly in this country. In the last year, fourth quarter of 2016 compared to fourth quarter of 2015, there's a 15% growth. And if you look at where the growth is taking place currently, the volume of procedures across the country and early adopters, gynecology and urology, has been flat for a while. Pretty much all this growth across the country and in the world actually has been in general surgery. And you can see on the left the number of systems that are installed in other countries and in the United States. If you're going to look at the reason for this rapid growth, it's probably multifactorial. The optimist view is that the robot affords greater precision and maneuverability than a laparoscope would, that the robot is less invasive than an open technique, that the robot enables the conversion of open procedures that are traditionally done open to an MIS approach. It's more ergonomic for surgeons, better outcomes than the alternatives, and that patients are demanding this. The pessimist view for the reasons behind the rapid growth is that demand is being driven by marketing from a large and powerful sales force, that surgeon champions are well compensated to create a buzz, and that the usefulness and utility in procedures where it might present a clinical advantage has led to utilization in procedures where it makes absolutely no sense. Like most things, excuse me, the truth is likely somewhere in between. So if you're going to look at Intuitive Surgical's annual report, in 2016, they made a little over $2.5 billion in revenue, and you can see it's from instruments, the surgical systems themselves, and service contracts. I'm on this podium in large part because I published a paper that wound up on the IHC and created a bit of a discussion. I pointed out, so the point of this paper was to look at the costs of robotic surgery in my healthcare system. So we're a 3-hospital system with 3 robots. And if you have laparoscopic privileges for a particular procedure, you can do a similar procedure robotically. So I just was interested, pulled data from our cost accounting software and showed that for cholecystectomy, fundoplication, and inguinal hernia, the costs were greater in the laparoscopic approach. And obviously, this is early in our experience, only 12 patients in the robotic inguinal hernia. I'll draw your attention to the 2.7 robotic instruments we were using per case in this very small cohort. When you look at back at the revenue, Intuitive makes most of their money based on the instrumentation. And this is where most of the gap in costs when you compare robotic surgery to other approaches falls into play. And that's excluding the capital costs required to acquire the robot in the first place. And if you read Intuitive Surgical's prospectus on their financial model for investors, they talk about the razor blade model. They actually use that term. And so the robot itself is sold for a low profit, and the goal is to sell the instruments for a very high profit and at a very high volume. So value is something that we're all aware of, and quality is something that surgeons have cared about since there were surgeons. We've come to define it in some fairly nuanced ways lately. And so quality includes outcomes. It's increasingly including patient experience. But value, the concept of value, takes into account the cost to achieve those quality outcomes. And so direct and indirect costs, we could talk all day about different costs and how they're passed on and how to track a dollar through a hospital or a healthcare system. It's really hard and it's a very complex matter. But this is the value equation. So when you look at robotic surgery, first of all, if you take the technology as a whole and you just look at robotic versus open and robotic versus MIS, this is a nice systematic review that looks at it in many different disciplines and many different procedures. It includes urology, gynecology, general surgery. But just looking in general, if you were to compare a robotic approach to open and robotic to laparoscopy, clearly robotic has some significant gains for patients when you compare it to open. But in this meta-analysis at least, robotic surgery took a little bit longer than laparoscopy, and there was a slight advantage for the robotic approach when it came to blood loss. When you look at robotic hernia repair, and those of you that have been at this meeting listening to some of these panels have probably heard reference to the paucity of data with regards to this technique. I did a Pubmed search earlier this week. It used the keyword robotic hernia repair and got 140 hits. But when I looked through all these, there were only 16 that related to either robotic, inguinal, or incisional hernia repair, excluding reviews that didn't have patient data in it. This included 2 case reports, 10 case series. Of these case series, 70% had less than 25 patients. Retrospective comparisons of laparoscopy to robotics, there were 3 of those, including 39, 53, and 39 cases in the robotic arms. There was some overlap in authors and likely patients in this cohort. No randomized controlled trials, and really not enough good quality data to perform any kind of systematic review. And you're all familiar with the concept of levels of evidence. If you were to take the evidence as a whole for robotic hernia, it's basically level 3, grade C, mostly case series and cohort studies. Now, one would argue that if you look at this technology innovation S-curve, it's really because the robotic approach to hernia repair, I think we're past make it work into the maximizing efficiency stage. You saw some really great examples of that, some great talks just preceding me that show kind of where we're at here. And we might be moving along the line to minimizing cost. And this seems to be one of the most common criticisms of using the robot is the cost associated with it. And if you'll notice, there's another line here which says next generation. And I think this is really what's going to happen, is we're going to have some other robotic technologies that hit the market. We're going to have kind of a different approach to the whole thing. There may be even some alternative instruments that will change the way we deal with some of the challenges to laparoscopy with these cases that have led us to adopt a robot. So we're moving along the curve, but right now we're somewhere in this early stage. A systematic review published looking at the cost of robotic surgery overall. Looked at 47 studies that were eligible. There were within this 6 full economic evaluations and 41 cost analyses. When hospitals and health systems consider acquiring this technology, they look at things like this. This is published in Applied Healthcare Economics. Some of the other consulting companies out there that help with value analysis reference these kinds of things. So this is what the hospitals, this is what they read. So this is a summary from this paper that says the hospital costs of robotic-assisted laparoscopy are higher than the alternatives, and the clinical effectiveness data is limited. That's kind of a generic summary statement of the level of evidence as it exists today. Quick word on value in healthcare in this country. The United States spends more per capita on healthcare than any other country in the world. If you talk about value in healthcare in this particular context, you would talk about the cost or the percent of the gross domestic product that we spend on our healthcare. This is the United States on the right, relative to the life expectancy. So sort of a surrogate for quality. And we're by far the worst off of any country in the world. We spend more and get less in our healthcare system. What's happening now is we're going to be paid differently very soon. We're not going to be paid for volume. We're going to be paid for value, and in very different ways. So coming soon, cost data for episodes of care will be readily available. It is now. You can go to cms.gov. You can look at cost per Medicare beneficiary. It's broken down by hospitals and regions. Guru.com is just one example of a website. It's based in Milwaukee, so I put this up there. I can look at my cost for a lap chole in my hospital compared to other hospitals in my region. And so patients can look at the cost, especially as they're accountable for more and more of the cost, and they can choose where they would go. And frankly, the business model at Guru is to offer this to employers and insurance companies to drive patients to the lowest cost providers, and that's going to start happening. So we need a better understanding of cost best practices and unnecessary variation. So what's next? I think that more robotic surgical systems will come on the market, as I referenced. I think that's going to help drive the cost down. Part of the reason that robotic instruments cost so much is that they're programmed currently to only be used 10 times, and then you can't use them again. And I think we'll see some movement in that arena. And then alternative instruments, like I said, there'll be some instruments that are similar to robotic things that are capable of doing some of the complex maneuvers. And so I really do think that we're going to have to start thinking more and more about this value equation. It's going to be forced upon us, whether we want to think about it or not. So what do we do in the meantime? Well, pay attention to cost. It does matter. I think the easiest thing we can do is minimize the number of robotic instruments used per case. And there's been a couple nice references to that today. Document and demonstrate improved outcomes and quality. with the cases that we're doing this way. And consider the fact that in some cases, it might actually be better to perform an operation laparoscopically. And I should have included open here. The robot's not the answer to everything. So pump your brakes. Don't drink the Kool-Aid. Hold your horses. The jury's still out. Who knows what the future of the robot holds. Thank you very much.